Hi, everyone. Dr. Partha, Nandi, and we're talking about tuberculosis in the U.S. Interestingly, you know, in Kansas right now, this is 2025, 67 people are being treated for active TB. Another 79 have inactive infections. So the TB outbreak continues to infect dozens of people in Kansas. So people go, what's active TB? What's inactive TB? Let me break it down for you. So active TB is when your immune system can't control the tuberculosis, right? So the bacteria is not under control, so it multiplies and it grows. People with active TB, they feel sick. They can have a cough that doesn't go away. They can have chest pain. They can even cough up blood. And most importantly, they can really easily spread it to others. Inactive TB, different. The bacteria stays in the body, right? Not causing any symptoms and can't spread. People don't get active symptoms. They may not even know they have it. And, they can't spread it as easily. So the bug that causes TB is a bacterium called Mycobacterium tuberculosis. And so now, remember, both inactive and active TB can be treated. So folks can go to their doctor and get antibiotics to get that treated. So what about, there's some people, for example, in Michigan, folks told us that there's an infection with the beef herd that was positive for bovine tuberculosis. So what is that? So that affects animals, and it's caused by a germ called Mycobacterium bovis. Mycobacterium bovis. So that's different. Now with animals, it spreads through respiratory secretions. Transmission to humans are rare, but it can happen if you handle animals for a prolonged period of time. You can get infected, so it's important to know that. Now, if you think that, hey, you know what, could I be someone who's affected by TB? Look for the symptoms, which is persistent cough. You can have night sweats, coughing up blood. You can have weight loss. Don't guess. Just talk to your doctor, because this is a treatable disease. And then listen. Bottom line, for most people, the risk is low, right? Risk is low. Even for bovine tuberculosis, most people who are not handling animals, it's good because, for example, we in Michigan, where I'm at, we typically have pasteurized milk, which kills off the bacteria, including the bacteria that's causing tuberculosis. So it's important to know that when you have places where our milk supply is regulated tightly with pasteurization. So bottom line, risk is low for most folks, but don't ignore the symptoms that I talked about. If you have them, talk to your doctor right away. I'm Dr. Partha Nandi.